everyone and welcome to my weekly Sunday 9 p.m. live video. I'm Dr. Tani Ping, consultant obstetrician and gynecologist. Today our topic is an obstetric topic and it is actually a very interesting topic to me because I face this problem every now and then. The thing is about 2 cesarean birth, and after 2 cesarean birth, if you're pregnant again, a lot of women gets very stressed up when they're pregnant again after 2 cesarean birth. Because at certain point, certain doctors are going to talk to them about the need to have, number one, they have to have cesarean again, and this time they need to tie their tubes or to do a procedure we call BTL. BTL meaning tying the tubes, bilateral tubal ligation. Why is it a problem? Because of a few reasons. When women go for cesarean birth, in the very first time when you go for a cesarean birth, doctors tell you why you need to do a cesarean. They tell you that there are certain risks involved, your baby's life may be at risk or your life may be at risk. We have no choice, we have to do a cesarean. And the second time you do a cesarean, again the same story will come up again. A lot of doctors again will tell you the same thing. But nobody actually tell you a few things. Number one, they don't tell you that after this Caesar, which is your second Caesar, your third must be a Caesar already. Because you see, after 1 Caesar, you can still try normal. After 2 Caesar, you cannot try normal anymore. But when we ask you to do a second Caesar, normally most doctors would not let you know that, Madam, after this Caesar, you have to do a second Caesar. Most doctors don't inform you that. So that is when you are not aware. So when you get your third pregnancy, and now doctor will tell you that you need a Caesar for this time. And not just a Caesar, we also need to tie your tubes. That is when a lot of women get shocked, because when they did the second Caesar, nobody told them that if you do a Caesar this time, the next time you need to do another Caesar and you don't have a choice anymore. You cannot try normal anymore. And also, you need to tie your tubes. And that is when a lot of women are very shocked. Why I choose this topic is because there was one of you who actually posted this question to me. She said that she already had 2 cesarean and now she need to go for, she's pregnant again, and she asked me if it is a must to tie the tube. Because somebody would have told her that you need to tie your tube. So now the question is, after 2 cesarean, the third pregnancy, the next birth, which is going to be a cesarean, is it a must to tie the tube? Why doctors ask you to tie the tube? Is it really a must? Before I answer you this question, I need to explain to you few issues involved. Why we want to tie your tube if you are going for a third Caesar? For me, I may not put it a must, but I would usually tell my mothers these situations. Some of them will opt to tie the tube, some may not. To me, I respect them. I sometimes do give them another opportunity, which is the 4th pregnancy. But normally after I inform them everything and they understand what they are going through, what they need to be responsible for, and if they are okay, and we know the mother is okay, then actually it's not really a must. But what do they need to know? Number one, you see, when it comes to cesarean birth, we don't let you have many cesarean. That's why I always say natural birth is still the best. Most of you will know I encourage natural birth. Why I encourage natural birth? Natural birth, you can have so many children. Nobody is going to force you to tie your tubes. But you see, in cesarean, we are going to ask you to tie your tube because we won't allow you to have too many children. Why? Because with each cesarean birth, your risks increase. What are the risks that we are talking about? Number one, everybody knows about scar rupture. Everybody knows about scar rupture. Yes, the risk of scar rupture increases with each cesarean. And we know when you have scar rupture, there is a possibility that your baby may become a mentally retarded child. Because when scar rupture, usually there will be damage to the baby's brain. So is that something you are willing to accept? Because we know that with every Caesar, the percentage of scar rupture doubles. That is number one, but that's not the most important thing. There are other problems. We worry about cesarean scar pregnancy. Cesarean scar pregnancy is a pregnancy that happens at the cesarean scar. And this is a kind of a pregnancy that you cannot keep. If you know early in your pregnancy, in an ultrasound scan, doctor scan, and say, hey, madam, you have a cesarean scar pregnancy, that's fine, because then I would just tell you, you have to abort your baby. You have to abort your baby is because if we allow the baby to grow bigger, your life will be in danger. But unfortunately, not every woman go and see gynae at the very, very early stages of pregnancy. So if you miss this diagnosis of cesarean scar pregnancy, then the next problem is this baby that is going to grow in your cesarean scar will have high risk of either, number one, the scar rupture early, maybe rupture at 3 months, 4 months pregnant. You don't just lose a baby, you will almost lose your life, and almost 100% the doctor is going to remove your uterus. And you may end up with blood transfusion as well as ICU care. What if cesarean scar pregnancy is not too bad and it continues to let your pregnancy go on, then what you'll see is your placenta. Your placenta will be implanted at the Caesarean scar. And when the placenta implant at the Caesarean scar, this is what we call placenta accreta, percreta, increta. There's so many names to it. It all depends on how deeply implanted is the placenta on your scar. And what does it mean? What is placenta accreta? So what? Placenta accreta, when you have it, number one, high chance you're going to bleed like mad when you give birth, which means that ICU care, blood transfusion, and most likely you will lose your uterus. If you can reach up to 9 months, baby usually fine, not too much of a problem, but you will most likely lose your uterus, ICU care, blood transfusion, and you may not survive. And because of that, we all worry about all these risks. So when women ask me, is it a must to have a tubal ligation? Is it a must to have a BTL? My answer would be very simple. I will explain to them all these risks. So this risk comes about life-threatening risk. You may die if you keep on getting pregnant again and again, or your baby may die. So if you don't want a tubal ligation, it's very simple. Number one, can you be 101% sure, really 101% sure, you will not get pregnant after this? Because a lot of women will tell me, all this while I plan myself, you see, all my pregnancy are planned. I know how to prevent pregnancy. But my question to her would be, are you sure, 101% sure, that you will never get pregnant? So that is the tricky part. Because even though no matter how you think that you can prevent pregnancy, there is no contraception in this world that is 101% safe. So that would be a problem. And you see, we have seen so many women on all sorts of contraception. Even if you give them the most reliable contraception, there's always over the years, they will think that maybe this thing is causing me side effects, maybe I'm putting on weight because of it, maybe I'm getting old because of it, and they will stop using the contraception. That is when danger comes. So the first criteria, if you were to choose not to go for tubal ligation, then you must ask yourself whether you are 101% sure you will never get pregnant. And the next question you need to ask yourself, because we know nothing is that safe, there's no contraception that is even 100% safe. So let's say if you get pregnant again, are you willing to lose your baby? Are you willing to abort your baby? Are you willing to lose your uterus? Because the few things you need to understand, you may need to abort your baby, a live baby, you have to abort. Not all women will abort their baby. Religious reason, attachment reasons. Not many women are willing to abort their baby. I have seen so many women that when we counsel them to abort, they just keep holding on and holding on and holding on, and they just can't do it. The whole family, the husband, the relatives, they can think that that is the best choice for you, please abort the baby. But not many women can actually walk that path, knowing that the baby is well. Second, are you willing to lose your uterus? Because if you're going to have a Caesarean scar pregnancy, placenta accreta, placenta percreta, if you carry on with the pregnancy, or you didn't know you have this complication until it was too late, you're most likely going to lose your uterus. Are you willing to lose your uterus and live the rest of your life without a uterus? And last, are you willing to risk your life in the ICU knowing that you're dead? You may survive and you may not survive with your first 2 other children who are still young at home just because you decided not to do a tubal ligation. This is again a thing that I always face. Most women at the point of life and death, the only thing they worry are the other children at home. So the fact that you have 3 or 4 pregnancies already, you will have 3 or 4 children at home that need a mother, and why you want to risk your life for them. So as far as my patients are concerned, my mothers are concerned, I don't always put it as a must. I tell it to them and let them make their decision. Because I truly believe that contraception, if you really do it properly and you're really committed to it, some women can be 101% sure. And as far as I'm concerned, 101% sure is double contraception. Double. You cannot just use one, because there's no contraception in this world that's 100%. So if you want to know more about contraception, go to my contraception video. I have a contraception video in my YouTube channel. Go to my YouTube channel, Dr. Tan City Clinic. I have a video on contraception. I have a video on complications of Caesarean scar. Go and look through it. I have a video on placenta previa, accreta, and percreta. Go and understand all these complications, because all these complications are related to Caesarean birth. So when you can put yourself on double contraception, yes, maybe. For example, like myself, I'm on Mirena, my husband uses a condom. Both must be on contraception. Mirena is 99.9%. And yet with that, I still make my husband use a condom. So I'm not going to get the 0.1% chance of pregnancy. No way. Because if you choose this path, that means you choose not to have your tubal ligation done, then you better make sure your contraception is more than 100% guarantee, no pregnancy, and you must be committed to the contraception. That means irrespective of what side effect, you're just going to go on with it. Like last week, I have this lady. She had 4 children. In fact, she will tell you that the last child is unplanned. It was an accident. You see, accidents happen all the time. And because it was an accident, when she came to me, I told her, you need to have a secure contraception. So I told her the best is Mirena for you, because Mirena is 99.9%, so it's the best for you. And she's okay. She put in a Mirena because she doesn't want the 5th baby already. 3 years later, she came to see me. That was last week. Do you know what she did? She wanted the Mirena out. Do you know why she wanted the Mirena out? She says that the Mirena is making her look older and older. She said, everybody say I look so old, look like I'm aging very fast. I think it's due to the Mirena. So she wanted the Mirena out. And guess what happened? She didn't come alone. She came with her sister, her elder sister. Her elder sister saw me after her. And true enough, I thought the elder sister was the younger sister. I said, at first I thought she's the younger sister. I said, your elder sister just saw me. He said, no, that's my younger sister. Okay, I said, no wonder she wanted to remove her Mirena. She does look older than you. He said, no lie, it's because she got 4 children. I don't think it's due to the Mirena. She got 4 children and she lost so much weight. You see, her elder sister, who is an outsider, she sees her younger sister losing so much weight and struggling with 4 children. To her, it's her 4 children and her losing so much weight is the cause of her aging, not the Mirena. But for her younger sister, she thinks the Mirena is the one to be blamed, and she took out the Mirena. And you know, and before she left my room, she said what, hopefully I don't get pregnant again. I was like, oh my God. So that's our worry. So why doctors insist, especially like in government hospital, they literally insist that you have a tubal ligation, is because they cannot trust you. They cannot trust women on contraception. Women blame anything on contraception. They blame their weight gain on contraception. They blame their aging on contraception. They blame their pimples on contraception. They blame their pigmentations on contraception. But they never blame the most important thing. That is aging is the cause of all this problem. Nothing to do with contraception. So that's why we make sure they have a tubal ligation. But as far as my patients are concerned who don't want, I'm okay. I let them know all the complications and I sit down with them. Are you 100% committed to make sure that you're on double contraception? I have women who take pill, oral contraceptive pill, and also put an IUD inside the uterus. Oh, that is 101% sure you're not getting pregnant. Then they're fine. Irrespective of side effect, you're going to use 2 methods of contraception. If you can do that, then it's fine. You don't want a tubal ligation, that's fine, but just make sure you don't get pregnant. Because if you get pregnant, the issues that you will have to face. If you're lucky, it doesn't happen on you, yeah? But you may not be so lucky because with each pregnancy, with each cesarean scar, chances of this thing happening gets higher and higher each time. So I ask you, are you willing to abort your healthy baby? Are you willing to lose your uterus and live the rest of your life without uterus? Are you willing to face life and death, leaving your other children who are still young behind? These are the questions you need to ask yourself. Alright, so this is what I have today, and thanks for your question again. For those of you who have not seen the rest of my videos, please go to my YouTube channel, Dr. Tan City Clinic. Please remember to subscribe and like my videos, yeah? Okay, so if you have missed the other topics, you can go and look at contraception for women. You can look at videos on cesarean scar complications. You can look at my video on placenta previa, placenta accreta, so that you understand a bit more on all these risks that come with multiple cesarean birth. Alright, this is the last video for this year, yeah? So we'll take a break for the Christmas and New Year, and I'll be back after the New Year. So to all of you, enjoy your holidays. I'm sure many of you will be on holiday. I'll be on holiday too. So enjoy your holidays, yeah, for this year end. And wish all of you a Merry Christmas, Happy New Year, and I'll see you after the New Year, yeah? So that's all for today. Stay tuned. 3 weeks from now. Bye-bye.